Okay, so the next progression on this is actually going to be a side plank. This is pretty high level, even though we're going to do a modified side plank. You would not want to do this with somebody their first time, and certainly not until they've demonstrated the ability to do these other activities. But from here, we're going to do it modified. So we're going to have the knees bent, and again, we're trying to keep a straight line from the thighs to through the torso. So we're going to actually move you back here just a little bit, and then from here you're going to come up on your right elbow. I'll warn you, people with shoulder issues are going to have difficulty with this, and if it's irritating anybody's shoulders, then we're just going to have to not do this. There's a way to make it easier if we need to, but let's come up there on your elbow, just like that. Good. And then from there, you're going to be picking your hips up towards the ceiling. Hold them there for 5 seconds. Good. And so that's a side plank, and it's hitting your abductors as well. Good. And then if a person is pretty good at this, we could actually have them side plank. So go ahead and side plank up again, and then do a little open book, and then back down. So that's a whole nother level, right? And that's a struggle in itself. But let's say that this wasn't a struggle. What would we do? We'd go ahead and straighten both legs out and make it more difficult. All right, so again, you're gonna line yourself up, and then from there, we're gonna pick up. You're gonna hold that position, and then back down. And then once that got proficient, then you would add that with a straight leg abduction, which I'll help you through. So go ahead and lift up, and then we're up there, and then back down. And again, remember, Daniel's in good shape. This is really difficult for him. Our patients are not going to start at this level, but we also want to have them, progress as tolerated. So that is the side plank sequence. If you have room to do this, and a person has difficulty doing that, you could always just go to a wall like this, and you can hold that plank, and then you can do some little hip abductions like that. So know that this is an option for you when a person is unable to tolerate that. We're trying to keep everything on the table, but certain things just aren't going to be, feasible to do on the table. In fact, even the hip flexor stretch that we talked about before might be something that's kind of difficult to do on the table. And long as I'm on that subject, I'll mention that you could even put a little cushion on the floor and do this hip flexor stretch where somebody still has a table to hold on to. They're doing that pelvic tilt, and then they're just stretching forward like that to get that stretch. Even standing at table side with the table elevated, you could be in this position, tuck, bend the front knee, and stretch that hip flexor. And again, this is something we covered in earlier parts of the video, but just so you know, our goal of keeping everything on tabletop might not be realistic, so those are just a couple little variations for you to remember.